The early years matter when it comes to lifelong mental well-being. Through their earliest relationships and experiences, young children develop social, emotional abilities that will serve them through adulthood. That's why GEARS, Georgia Early Education Alliance for Ready Students, along with state leaders, clinicians, and other partners, have focused on infant and early childhood mental health over the last few years.
We don't have very many memories from the first 3 years of life, but what happened then still affects us as adults and shapes our mental and emotional well-being.
When children are born, everything that we do impacts their futures. Their brain is growing so fast, about 1 million neuroconnections a second in those first 3 years. It's so important that we focus on that.
Infant and early childhood mental health is the developing capacity of a young child to form close relationships, manage and express emotions, and explore the environment and learn.
Why is infant and early childhood mental health important? Is it actually sets the foundation for all learning and development.
Infant and toddlers and young children, they have mental health just like adults do. It's not a scary thing. It's part of normal development.
Children aren't born knowing how to cope with stress or how to express emotions appropriately. They learn that through close relationships from their caregivers.
When we address early childhood trauma right after it happens, we set children up to succeed in school and work, to form close personal relationships, and to find joy and happiness as adults.
In 2019, GEARS supported the House Study Committee on Infant-Toddler Social-Emotional Health, chaired by Representative Katie Dempsey. This study committee transformed how Georgia addresses infant and early childhood mental health.
The Infant Toddler Study Committee on Mental Health a few years ago really brought us all of the partners to the table, willing to talk about it, willing to recognize that there's a lot of work to do here in Georgia.
We've clarified Medicaid billing codes for infant and early childhood mental health services, and we have workforce development initiatives underway that will support access to infant and early childhood mental health services across the state. This means that more children will have access to developmentally appropriate care to support their mental well-being and set them on a path to social-emotional wellness throughout their lives.
I am grateful to live in a state in which our state leaders have dedicated resources to our youngest children and their families.
The study committee and the outcomes that we've seen from it would not have been possible if we didn't have that collaborative work that came about through so many agencies working together. The real push, the real muscle behind it was actually GEARS and the work that they do to help all Georgians realize the opportunities that we have.
The study committee's recommendations included state-level leadership to address infant and early childhood mental health, including a director at the Georgia Department of Early Care and Learning, clarified Medicaid reimbursement for IECMH services, support for the IECMH workforce. To address the last recommendation, GEARS and partners formed the Georgia Association for Infant Mental Health, now housed at Georgia State University.
The Georgia Association for Infant Mental Health, Birth to 5, or Georgia AIM, is really a hub for training, advocacy, and resources. The vision of Georgia AIM is for all young children to be raised in safe and nurturing environments so that they are able to reach their full potential.
A focus for Georgia AIM is to really increase awareness on what is infant and early childhood mental health, so that a wide range of professionals working with young children have a common understanding of the importance of a young child's development and the services they can access in order to support that development.
Georgia Association of Infant Mental Health has really taken a stand in terms of really being a champion with providing awareness and advocacy around the early development of young children.
We've made a lot of strides here in Georgia, but we've still got a lot of work to do.
Whatever happens in policy level decisions trickles down and impacts the very youngest of our members of our society.
Georgia will certainly benefit from the advocacy work that has been done because our children will be healthy. They'll have a great deal of social emotional development and be able to relate with their peers as well as thrive and grow in the future.
To support infant and early childhood mental health, we can build awareness of the importance of early relationships and experiences, bring caregivers to the table when making policy and designing services, provide training on early childhood trauma to members of the child-serving workforce, and continue to build the capacity for caregiver child therapy.
The developments for the future, I think, really hold so much promise. Well, as Georgia grows, so grow the number of babies and children that continue to need these services. So we must continue to be vigilant in this work. It's more than one touch, one pediatrician, one office visit. It's a constant field that has to be fertilized in essence. It's like growing a flower, but it's really more important because it's growing a brain.
Through advocacy, convening, and partnership, GEARS centers the needs of young children and their families in both policy and practice. To learn more, visit www.gears.org/mental health.